Welcome, nurses, to day 11 of our 30 Days NCLEX Challenge. In this powerful 30-day challenge, we solve one practice test every day. And by the end, you'll have mastered 2,000 plus hand-picked NCLEX questions that reflect the most repeated and high-yield exam content. If you stick with us daily, no one can stop you from passing the NCLEX on your first try. Before we begin today's questions, I want to remind you that you can enroll in our online NCLEX Crash Course, where we're currently offering a 70% discount. More than 100,000 students have already passed the NCLEX on their first attempt through this course. Visit our website to enroll. The link is in the description box below. Now, let's begin with question 1. Let us move forward with this important question that highlights proper oral care for a client with stomatitis. Question 1. A nurse is teaching a client with stomatitis about appropriate oral care practices. Which of the following instructions would be most suitable? Here are the options. A. Advise the client to use an alcohol-based mouthwash for rinsing. B. Offer lemon glycerin swabs to use between meals. C. Encourage the client to rinse and spit with a saline solution. D. Instruct the client to clean their mouth using chlorhexidine rinse. The correct answer is C. Encourage the client to rinse and spit with a saline solution. This recommendation is ideal because a saline rinse, particularly when mixed with sodium bicarbonate, provides a soothing and non-irritating option for inflamed mucosa. It gently cleanses the mouth, helps keep tissues moist, and supports healing in clients with stomatitis. On the other hand, alcohol-based mouthwashes and lemon glycerin swabs can be too harsh and may worsen oral irritation, while chlorhexidine, although useful in some situations, may be too strong and cause additional discomfort for these clients. Let us continue to the next question. Now let us transition to question 2, which focuses on patient safety and management responsibilities. The scenario is as follows. As the nurse manager of a surgical acute care unit, you have noticed multiple incidents where clients were nearly taken to the preoperative suite for surgeries that were not actually scheduled for them. Fortunately, each of these errors was identified before any wrong procedure occurred. What should be your top priority in this situation? Here are the options to consider. A. Offer positive feedback to the staff for recognizing and preventing these near misses. Begin an investigation to examine the causes of these near misses. C. Treat these incidents as medical errors and investigate accordingly. D. File a report with the State Department of Health regarding these medical errors. The correct answer is B. Initiate a thorough review to examine the causes of these near misses. The reason behind this is that the immediate priority in such situations is to investigate the near misses thoroughly, identify what went wrong, and implement corrective measures to prevent actual errors in the future. It is essential to act promptly, ideally within 24 to 48 hours, while the details are still fresh in the minds of the involved staff. Although offering positive feedback is supportive, and reporting to regulatory bodies may be necessary later, the most urgent and impactful step is to analyze the root causes and strengthen safety protocols. Let us move ahead to the next question. Let us now move on to question 3, which focuses on post-procedure care for a client undergoing a skin biopsy. The situation is as follows. A nurse is caring for a client who has just returned from a circular punch skin biopsy performed to confirm a diagnosis of skin cancer. What should be the nurse's priority observation at the biopsy site? The options given are A. Wound separation dehiscence, B. Signs of infection, C. Bleeding, D. Swelling. The correct answer is C. Bleeding. This is because the immediate priority after a punch biopsy is to monitor for bleeding at the site, as the procedure removes a full-thickness plug of skin using a circular blade, making bleeding the most immediate concern. Although dehiscence, infection, or swelling can occur, dehiscence generally happens days after larger surgeries, infection signs take time to develop, and swelling is expected as a normal tissue response. Next, let us transition to question 4, which addresses newborn immunization practices. The nurse is assessing a 4-day-old full-term newborn. Which immunization should the nurse expect to administer or confirm has been given at this time? The options presented are A. Hepatitis A vaccine, B. Hepatitis B vaccine, C. Rotavirus vaccine, D. Diphtheria, tetanus, and pertussis, DTaP vaccine. The correct answer is B. Hepatitis B vaccine. This is because the hepatitis B vaccine is recommended as part of a 3-dose series beginning at birth, usually administered before hospital discharge or at the newborn's first pediatric visit. Hepatitis A vaccine is not given until 12 months of age, while both the rotavirus and DTaP vaccine series start at 2 months, making them inappropriate for a 4-day-old infant. Continuing on to question 5, we focus on health promotion strategies related to urinary health. The nurse is teaching a client about using cranberry juice as part of the plan to help prevent recurrent simple cystitis. What is the intended effect of consuming cranberry in this context? The options are A. Raise the urine-specific gravity, B. Increase the urine leukocyte count, C. Acidify the urine, D. Increase protein levels in the urine. The correct answer is C. Acidify the urine. This is because cranberry juice or tablets help acidify the urine, creating an environment that is less hospitable for bacterial growth, which may reduce the risk of recurrent infections. In contrast, increasing specific gravity could worsen the risk. Elevated leukocytes indicate existing infection, and higher protein levels point to kidney damage rather than prevention. Imagine this. You sit down to check your NCLEX results, and there it is. Pass. That moment of relief and pride is what we want for you. Our NCLEX Success Package is designed to help you get there with confidence. You will join live classes where you can engage with expert instructors, follow 100 hours of animated crash content that simplifies complex material, and access 500 hours of recorded lectures to fit your schedule. You will practice with 500 next-gen NCLEX questions, explained clearly, 5,000 real NCLEX questions from previous exams, and 15 full mock tests that prepare you for the real thing. You will receive our exclusive NCLEX ebook, study planners tailored for 1 week, 1 month, or 3 months, and PDF notes to guide your study. Plus, you will have 1 year of full access to all materials. Enroll today and take the first step toward making that dream a reality. Link is in description. Moving forward to question 6, we explore the assessment of abdominal pain and associated findings. The nurse in the emergency department is assessing a client who reports colicky abdominal pain, nausea, vomiting, and yellowing of the eyes. Based on these findings, what condition should the nurse most strongly suspect? The options are A. Peptic ulcer disease, B. Hepatitis C, C. Cholecystitis, D. Hepatic encephalopathy. The correct answer is C. Cholecystitis. This is because cholecystitis often presents with colicky, episodic upper abdominal pain that may radiate to the shoulder or back, along with nausea, vomiting, and jaundice. Peptic ulcer disease does not typically cause jaundice. Hepatitis C may cause jaundice, but not colicky pain, and hepatic encephalopathy presents with confusion rather than colicky pain. Let us now proceed to question 7, which highlights prioritization in acute care. The nurse has just received the following reports about assigned clients. Which client should the nurse prioritize for immediate assessment? The options are A. A client with pancreatitis who has developed bruising around the umbilicus, B. A client receiving total parenteral nutrition with a capillary blood glucose of 159 milligrams per deciliter, C. A client who sustained an ischemic stroke 6 hours ago and has a blood pressure of 156/92 millimeters of mercury, D. A client with stable angina who reports a headache while using a transdermal nitroglycerin patch. The correct answer is A. A client with pancreatitis who has developed bruising around the umbilicus. This is because bruising in that area, known as Cullen's sign, suggests retroperitoneal bleeding, a potentially life-threatening complication of hemorrhagic pancreatitis that requires immediate intervention. The other findings, while important, do not indicate an immediate threat to life. Finally, for this section, let us look at question 8, focusing on emergency response. The nurse is evaluating a client and suspects a femoral artery occlusion based on the assessment. What should the nurse do first? The options are A. Elevate the affected leg, B. Apply a cold compress to the leg, C. Contact the primary healthcare provider without delay, D. Perform passive range of motion exercises on the leg. The correct answer is C. Contact the primary healthcare provider without delay. This is because a femoral artery occlusion is a critical emergency, and rapid intervention is necessary to restore circulation and prevent loss of the limb. Elevating the leg, applying cold compresses, or performing range of motion exercises would not address the arterial blockage and could worsen the situation by delaying care. Now, moving on to question 9, we shift our focus to evaluating the effectiveness of antidepressant therapy. The scenario is as follows. The nurse is monitoring a client who has been prescribed citalopram. Which of the following findings would best indicate that the medication is producing a desired effect? The options are A. Better muscle coordination, B. Circumstantial speech, C. Higher self-esteem, D. Improved attention span. The correct answer is C. Higher self-esteem. This is because citalopram, a selective serotonin reuptake inhibitor, is prescribed to treat depression and anxiety, and an increase in self-esteem reflects improvement in depressive symptoms. The primary goal of this medication. Better muscle coordination would be unrelated to this medication's purpose. Circumstantial speech is actually a feature of mania or psychosis rather than a sign of therapeutic response, and improved attention span is more associated with medications for attention deficit disorders, not citalopram. Let us continue to question 10, which highlights safe cast care practices. The situation is, the nurse is providing discharge instructions to a client who has a newly applied fiberglass cast for a fractured radius. Which client statement indicates a correct understanding of cast care? The options are A. To reduce swelling, I should keep my arm hanging down. B. If the cast feels uncomfortable, I can trim the edges with scissors. C. Applying a warm compress will help with pain and swelling. D. If my cast gets slightly wet, I should pat it dry and use a hair dryer on a cool setting. The correct answer is D. If my cast gets slightly wet, I should pat it dry and use a hair dryer on a cool setting. This reflects appropriate cast care, as keeping the cast dry is essential, and using a cool hair dryer can help remove moisture and prevent skin irritation. Keeping the arm dependent would actually increase swelling. Trimming the cast edges with scissors could cause skin injury, and warm compresses are not recommended for reducing swelling. Cold therapy would be more appropriate. Pass the NCLEX with a course that gives you everything. With our NCLEX Success Package, you get live classes, 100 hours of animated crash course content, 500 hours of recorded lectures, and 500 next-gen NCLEX questions explained in depth. You will practice with 5,000 real NCLEX questions and 15 CAT-style mock tests. The package includes an NCLEX ebook, study planners for 1 week, 1 month, and 3 months, PDF notes, and 1 full year of access. Enroll today, link is in description. Next, let us look at question 11, which focuses on medication management for acute pancreatitis. The scenario reads, the nurse is admitting a client with a new diagnosis of acute pancreatitis. Which medication should the nurse expect to be prescribed? The options include A. 3% saline infusion, B. Fentanyl, C. Diphenoxylate atropine, D. Sucralfate. The correct answer is B. Fentanyl. This is because pain management is a critical aspect of treating acute pancreatitis, and opioids like fentanyl are typically used to provide effective relief from severe epigastric pain. Hypertonic saline is not used in pancreatitis management. Diphenoxylate atropine could increase the risk of ileus, and sucralfate is for gastric ulcers rather than pancreatitis. Proceeding to question 12, we address fluid intake calculation. The nurse is calculating the fluid intake for a client over the previous 12-hour shift. The client received 1 150 milliliter intravenous antibiotic, 1 8-ounce cup of coffee, 1 8-ounce cup of ice cream, 3 8-ounce cups of water, and 2 10 milliliter normal saline flushes. What is the client's total fluid intake in milliliters? The correct answer is 1,370 milliliters. This is because the intake includes 150 milliliters from the antibiotic, 240 milliliters from the coffee, 240 milliliters from the ice cream, 720 milliliters from the water, and 20 milliliters from the flushes, for a total of 1,370 milliliters. It is important to remember that any liquid at room temperature counts toward intake, and conversions such as 1 ounce equals 30 milliliters are useful in calculations. Continuing on to question 13, we focus on prioritization during chemotherapy. The nurse is prioritizing care for several clients. Which client should the nurse assess first? The options are A. A client receiving chemotherapy through a peripherally inserted central catheter who reports blistering at the site. B. A client receiving chemotherapy who develops nausea and vomiting. C. A client on oral chemotherapy who reports mouth pain when drinking orange juice. D. A client undergoing external beam radiation therapy who is sitting with visitors in the family waiting room. The correct answer is A. A client receiving chemotherapy through a peripherally inserted central catheter who reports blistering at the site. This is because blistering at the site could indicate extravasation of the chemotherapy agent, which can cause serious tissue damage if not addressed immediately. The other scenarios, while important, do not indicate emergencies requiring immediate assessment. Finally, let us transition to question 14, which focuses on the initial response to an eye injury. The scenario is, the nurse is caring for a child who reports getting a wood chip in their right eye. What should the nurse do first? The options are A. Rub the eye to help remove the object. B. Rinse the eye with hydrogen peroxide. C. Check the child's visual acuity. D. Apply a cold compress to the eye. The correct answer is C. Check the child's visual acuity. This is the priority because it helps assess how the injury is affecting vision and guides further management. Rubbing the eye could cause more damage. Hydrogen peroxide is not appropriate for eye irrigation, and cold compresses are for bruising, not foreign body removal. Let us now move to question 15, where we shift our focus to maternal care during labor. The scenario is as follows. The nurse is monitoring a client in labor who has just received epidural analgesia. What should the nurse watch for as a common complication? The options are A. High blood pressure, B. Bladder distension, C. Low body temperature, D. Rapid labor progression. The correct answer is B. Bladder distension. This is because epidural analgesia can reduce bladder sensation, meaning the client may not feel the urge to void, which can lead to bladder distension. This distension can interfere with labor progress and cause discomfort. It is worth noting that epidural analgesia is more commonly associated with low blood pressure rather than high blood pressure. Hypothermia is not typically linked to epidurals. And rather than speeding up labor, epidurals can actually slow the second stage of labor. Next, let us proceed to question 16, which focuses on the emergency management of electrolyte imbalances. The nurse is caring for a client with a kidney injury who has a serum potassium level of 6.1 milliequivalents per liter. What should the nurse do first? The options presented are A. Request a prescription for a diuretic to increase urine output. B. Check the client's sodium level. C. Start continuous cardiac monitoring. D. Encourage the client to drink more fluids. The correct answer is C. Start continuous cardiac monitoring. This is because a potassium level that high places the client at significant risk for life-threatening arrhythmias, and immediate heart monitoring is necessary to detect and address any dangerous rhythm changes. Although diuretics might eventually help lower potassium levels, they are not the immediate priority. Checking sodium levels does not address the urgent risk, and simply encouraging fluid intake will not control severe hyperkalemia effectively or promptly. Let us continue with question 17, which highlights newborn safety education. The nurse is teaching parents of a newborn with hyperbilirubinemia about signs that could indicate kernicterus. Which symptom should the nurse emphasize as a red flag? The options are A. Jaundice spreading from the head down, B. Poor feeding and unusual sleepiness, C. Fast breathing and bluish lips, D. Loud, persistent crying and irritability. The correct answer is B. Poor feeding and unusual sleepiness. These signs are key indicators of kernicterus, a dangerous accumulation of bilirubin in the brain that can lead to permanent damage if not addressed immediately. While jaundice spreading downward is common in newborns and not specific for kernicterus, fast breathing and cyanosis are more associated with heart or lung issues, and crying and irritability are non-specific symptoms that do not point clearly to kernicterus. Moving ahead to question 18, we focus on post-myocardial infarction emergency care. The nurse is caring for a client recovering from a myocardial infarction who presents with a heart rate of 110 beats per minute, blood pressure of 86/58 millimeters of mercury, crackles in the lungs, shortness of breath, dusky skin, and jugular vein distension. What is the nurse's highest priority action? The options are A. Administer medications to improve stroke volume. B. Provide pain medication. C. Obtain a stat electrocardiogram and troponin levels. D. Administer intravenous fluids to raise blood pressure. The correct answer is A. Administer medications to improve stroke volume. These signs point to cardiogenic shock, where the heart is not pumping effectively. The nurse's priority is to improve cardiac output, and this is best done through inotropes or vasopressors. Pain medication and diagnostic tests are important, but will not correct the immediate hemodynamic crisis. Intravenous fluids would risk worsening pulmonary edema, given the presence of crackles and jugular vein distension. Now on to question 19, which evaluates therapeutic outcomes of muscle relaxant therapy. The scenario is, the nurse is evaluating a client who has been prescribed tizanidine. Which client statement would indicate that the medication is having its intended effect? The options are A. I can focus better than before. B. My muscle spasms have decreased. C. My short-term memory has improved. D. I can sleep through the night without waking up. The correct answer is B. My muscle spasms have decreased. Tizanidine is prescribed to reduce muscle spasticity, often in conditions like multiple sclerosis or spinal cord injury. While improved sleep may occur secondarily due to fewer spasms, the direct goal of the medication is to relieve muscle tightness. It does not affect focus, memory, or cognitive function directly. Moving ahead to question 20, we focus on fall prevention strategies for high-risk clients. The situation is as follows. A client with a history of frequent falls is admitted to the unit. What is the most effective nursing measure to help prevent this client from falling? The options are A. Promote independent walking to strengthen muscles. B. Activate the bed alarm system to alert staff if the client attempts to get up. C. Perform a fall risk evaluation every other day. D. Confine the client to bed to avoid the chance of falling. The correct answer is B. Activate the bed alarm system to alert staff if the client attempts to get up. This measure ensures that staff are promptly notified if the client tries to get out of bed unassisted, allowing immediate action to reduce the risk of a fall. Encouraging independent walking without supervision could increase fall risk. Fall evaluations should occur more frequently and not just every other day. And unnecessary bed confinement can lead to other complications, such as deconditioning and pressure injuries. If you are feeling anxious about the NCLEX, let us help ease that stress. Our complete NCLEX review course provides a complete support system. You will join live classes with experienced instructors who are dedicated to helping you succeed. Our 100 hours of animated crash course material explains complex topics in a way that is easy to follow, and our 500 hours of recorded lectures allow you to study whenever it suits you best. You will practice with 500 next-gen NCLEX questions explained in detail, 5,000 previously asked NCLEX questions, and 15 mock tests designed to build your confidence. The course includes an exclusive NCLEX ebook, study planners for any timeline, whether you have 1 week, 1 month, or 3 months, and PDF notes to reinforce key concepts. You will have 1 full year of access to all these resources after you enroll. Join now and let us help you prepare with confidence. Let us now proceed to question 21, which addresses adolescent substance abuse education. During a health class on substance abuse, a teenager makes a comment about heroin use. Which statement suggests the teen needs further education about the dangers of heroin? The options are A. Heroin use can lead to strong physical dependence. B. Sharing needles when using heroin can spread infections like HIV. C. Heroin use can dangerously slow breathing. D. It is safer to use heroin with friends around than to use it alone. The correct answer is D. It is safer to use heroin with friends around than to use it alone. This is because there is no safe context for heroin use. Whether used alone or with others, heroin poses a high risk of overdose and death. The other statements correctly describe the risks associated with heroin use. Continuing on to question 22, we shift to mobility safety. The scenario is, the nurse observes a student nurse assisting a client who has weakness on the left side with daily activities. Which student action would require the nurse to intervene? The options are A. The student helps the client put their weaker arm into the shirt sleeve first. B. The student provides the client with shoes that have Velcro fasteners. C. The student positions the wheelchair on the client's weaker side for transfer. D. The student gives the hairbrush to the client's stronger hand. The correct answer is C. The student positions the wheelchair on the client's weaker side for transfer. This action increases the risk of falls, as assistive equipment should always be positioned on the client's stronger side to facilitate safer transfers. The other actions support the client's independence and safety. Moving forward to question 23, we look at emergency care for a snake bite. The situation is, a client arrives at the emergency department after being bitten on the arm by a snake. After confirming resuscitation, equipment is ready at the bedside. What is the nurse's priority action? The options are A. Call poison control for advice on antivenom administration. B. Check that the client's intravenous lines are functioning properly. C. Apply a tourniquet above the site of the bite. D. Monitor for symptoms like fever, rash, nausea, or joint pain. The correct answer is B. Check that the client's intravenous lines are functioning properly. This step ensures the client is ready to receive emergency treatments, such as fluids or antivenom, without delay. While contacting poison control is important, ensuring IV access comes first. Tourniquets are not recommended because they can worsen tissue damage, and monitoring for systemic symptoms is important but not the initial priority. Let us now move to question 24, which focuses on respiratory medication education. The nurse is teaching a client with chronic obstructive pulmonary disease about tiotropium bromide inhalation therapy. Which instruction is most important for the client to understand about using this medication? The options are A. Take the medication once daily, ideally at the same time each morning. B. Increase the number of doses if breathing becomes more difficult. C. Keep the inhaler in the refrigerator to extend its shelf life. D. Prime the inhaler by spraying it into the air before every use. The correct answer is A. Take the medication once daily, ideally at the same time each morning. Tiotropium is a long-acting bronchodilator meant for daily maintenance therapy, not for immediate relief. Clients should not change the dose on their own, and it should be stored at room temperature, without the need for priming before each use. Continuing to question 25, we focus on postoperative urinary catheter care. The scenario is, a 74-year-old client is 2 days postoperative from bladder prolapse surgery and has an indwelling urinary catheter. During rounds, the client tells the nurse, "I feel like I need to urinate again." What is the nurse's best response? The options are A. That feeling is probably just bladder spasms. Do not worry. B. I will check to see if your catheter is draining as it should. C. Try doing Kegel exercises to help stop the urge. D. Has this feeling happened to you before? The correct answer is B. I will check to see if your catheter is draining as it should. The priority is to assess catheter patency, as blockage can cause bladder distension and discomfort. The nurse should not dismiss the complaint, recommend exercises that are not appropriate while catheterized, or delay assessment by focusing on history alone. Finally, let us move on to question 26, which centers on antipsychotic medication outcomes. The nurse is evaluating a client who is taking risperidone. Which finding would best suggest the medication is working as intended? The options are A. The client reports weight loss. B. The client shows fewer mood swings. C. The client walks with a steady, normal gait. D. The client expresses fewer paranoid thoughts. The correct answer is D. The client expresses fewer paranoid thoughts. Risperidone is prescribed to manage psychotic symptoms, such as paranoia, and delusions. So, a reduction in these thoughts reflects a positive therapeutic effect. The other findings do not directly relate to the intended effect of this medication, and in fact, risperidone may cause weight gain or motor side effects rather than improvement in those areas. Let us now move to question 27, where we focus on emergency cardiac care. The situation is, a client is admitted with an acute myocardial infarction. What intervention should the nurse expect the healthcare provider to order right away? The options are A. A stress test to evaluate exercise tolerance. B. A CT scan of the chest with contrast. C. An emergency percutaneous coronary intervention. D. An echocardiogram to assess heart function. The correct answer is C. An emergency percutaneous coronary intervention. This is because PCI is the gold standard for promptly opening a blocked coronary artery during an acute myocardial infarction, restoring blood flow, and minimizing heart muscle damage. A stress test is not appropriate during an active heart attack. A CT scan may show anatomy, but does not treat the blockage. And an echocardiogram assesses structure, but does not address the immediate cause of the myocardial infarction. Next, let us transition to question 28, which highlights the role of crisis helplines in mental health care. The scenario is, why are crisis helplines considered a critical resource in mental health care? The options are A. They make it easier for nurses to arrange home visits. B. They help the caller and staff coordinate long-term follow-up care. C. They provide a free service that focuses on teaching coping skills. D. They can be life-saving for individuals experiencing a severe crisis. The correct answer is D. They can be life-saving for individuals experiencing a severe crisis. This is because helplines provide immediate, accessible support during moments of acute distress, helping to prevent self-harm or suicide. Although helplines may encourage follow-up care, their primary purpose is crisis stabilization, not arranging home visits or teaching coping strategies. Moving on to question 29, we focus on preventing mother-to-child transmission of HIV during labor. The scenario is, a client in labor has tested positive for human immunodeficiency virus. Which medication should the nurse expect the healthcare provider to prescribe to reduce the risk of transmitting HIV to the newborn? The options are A. Valacyclovir, B. Zidovudine, C. Amphotericin, D. Metronidazole. The correct answer is B. Zidovudine. This medication is administered during labor, typically intravenously, to help reduce the risk of vertical transmission of HIV, especially if the maternal viral load is not well controlled. Valacyclovir is for herpes infections, amphotericin B treats fungal infections, and metronidazole is used for bacterial or parasitic infections, none of which are appropriate in this context. Let us proceed to question 30, which examines effective staff management. The scenario is, a nurse manager notices that a staff nurse has been returning late from lunch breaks on multiple occasions. What should the manager's first action be? The options are A. Continue observing the nurse's behavior to see if it improves. B. Issue a written warning documenting the tardiness. C. Require the nurse to report in and out for lunch breaks. D. Speak with the nurse about the impact of being late and potential consequences. The correct answer is D. Speak with the nurse about the impact of being late and potential consequences. Addressing the issue directly through professional dialogue allows for improvement without being unnecessarily punitive. Continued observation without action or jumping directly to formal discipline is not appropriate at this stage. Are you ready to crush the NCLEX? Our NCLEX Mastery course is built to help you succeed with confidence. We offer live classes so you can engage directly with expert instructors, plus 100 hours of powerful animated crash course material that simplifies complex concepts. You will also get 500 hours of recorded lectures, 500 next-gen NCLEX questions broken down in detail, and 5,000 actual NCLEX questions from past exams to give you the edge. Our 15 CAT-style mock tests simulate the real exam experience, so you can go into test day feeling prepared. On top of that, you will get an exclusive NCLEX ebook, PDF notes, and customized study planners for 1 week, 1 month, or 3 months. And with a full year of access, you can study at your own pace. Enroll now and give yourself the advantage. Now, let us move to question 31, which centers on prenatal nutrition education. The scenario is, the nurse is teaching a prenatal nutrition class. Which guidance should the nurse give to the group? The options are A. Raw sushi is safe during pregnancy because it provides protein. B. You should limit your caffeine intake to less than 200 milligrams a day during pregnancy. C. Eat citrus fruits or strawberries to boost your iron levels. D. Sodium intake should be limited to 1 gram daily throughout pregnancy. The correct answer is B. You should limit your caffeine intake to less than 200 milligrams a day during pregnancy. Excess caffeine intake has been linked to miscarriage and preterm birth, so moderation is key. Raw sushi should be avoided to reduce the risk of foodborne illness. Citrus and strawberries enhance iron absorption rather than supply iron themselves, and sodium needs actually increase during pregnancy unless medically restricted. Finally, let us continue to question 32, which focuses on prioritization in respiratory care. The scenario is, the nurse is prioritizing assessments for assigned clients. Which client should the nurse check on first? The options are A. A client with pneumonia who has an oxygen saturation of 90% on 4 liters of oxygen by nasal cannula. B. A client with left empyema who has a fever of 102.4 degrees Fahrenheit and heart rate of 104. C. A client with a chest tube showing gentle bubbling in the water seal chamber during exhalation. D. A client with a right pleural effusion and reduced tactile fremitus on that side. The correct answer is A. A client with pneumonia who has an oxygen saturation of 90% on 4 liters of oxygen by nasal cannula. This client is showing signs of significant hypoxia despite supplemental oxygen and requires immediate assessment and possible intervention to prevent respiratory failure. The other client's findings, while important, do not indicate an immediate threat to life. Let us now transition to question 33, which focuses on the emergency management of major burns. The scenario is, the nurse in the emergency department is caring for a client with major thermal burns involving 22.5% of their total body surface area. In which order should the nurse complete the following actions? The correct sequence is assess airway, breathing, circulation, and obtain vital signs, start oxygen therapy if needed, and cover burns with sterile dressings. Insert a large bore intravenous catheter into unburned skin. Start intravenous isotonic fluid replacement as prescribed. Insert a urinary catheter to monitor urine output. Give tetanus prophylaxis as ordered. This sequence ensures that life-threatening issues are addressed first, followed by steps that stabilize the client and prevent complications. Airway and breathing always take priority, followed by circulation, fluid resuscitation, and monitoring urine output to assess perfusion. Tetanus prophylaxis is administered after critical measures are in place. Next, let us move to question 34, which highlights compassionate, client-centered care. The scenario is, the nurse is caring for a client who feels self-conscious about their hair and asks to have it washed before undergoing tests. What is the nurse's best response? The options are A. Offer a scarf or cap to cover the hair and suggest washing it afterward. B. Focus on scheduling tests and meals first and address hygiene if time allows. The C. Prioritize dressing changes and testing first, with hygiene last. D. Assist the client with washing their hair and hygiene before arranging tests and counseling. The correct answer is D. Assist the client with washing their hair and hygiene before arranging tests and counseling. Supporting the client's emotional and physical comfort fosters dignity and well-being. Delaying or deflecting the request may overlook the client's immediate need for self-esteem support. Let us continue with question 35, which focuses on gastrointestinal protection. The scenario is, a client with peptic ulcer disease related to long-term NSAID use is prescribed misoprostol. When educating the client about how this medication works, what should the nurse explain? The options are A. It helps prevent gas buildup. B. It speeds up how fast the stomach empties. C. It forms a protective lining in the stomach. D. It strengthens the lower esophageal sphincter. The correct answer is C. It forms a protective lining in the stomach. Misoprostol increases mucus and bicarbonate production, shielding the stomach lining from the damaging effects of acid and NSAIDs. Moving on to question 36, we focus on evaluating narcolepsy treatment. The scenario is, the nurse is evaluating a client being treated for narcolepsy. Which finding suggests that treatment is effective? The options are A. The client reports better concentration. B. The client has fewer episodes of falling asleep during the day. C. The client reports fewer nightmares. D. The client shows more social engagement. The correct answer is B. The client has fewer episodes of falling asleep during the day. Narcolepsy is characterized by excessive daytime sleepiness, so a reduction in sleep attacks is a clear indicator of therapeutic success. Next, let us proceed to question 37, which focuses on understanding intimate partner violence. The scenario is, during a staff training session on intimate partner violence, which statement by a participant would show correct understanding? The options are A. Only clients at high risk need to be screened for IPV. B. We should tell clients that their IPV disclosure will not be shared with anyone. C. Men may hesitate to report IPV because of shame or stigma. D. Signs of IPV are usually visible on the face or hands. The correct answer is C. Men may hesitate to report IPV because of shame or stigma. Men often underreport due to societal expectations and fear of being disbelieved. Universal screening is recommended. Confidentiality must be balanced with reporting laws, and IPV injuries are often hidden under clothing. Continuing on to question 38, we focus on obstetric risk factors. The scenario is, the labor and delivery nurse knows that which fetal factor is most strongly linked to shoulder dystocia during birth. The options are A. A large birth weight, macrosomia. B. Prematurity. C. Abnormal fetal position. D. A low APGAR score at birth. The correct answer is A. A large birth weight, macrosomia. A larger fetus increases the risk of the shoulders becoming stuck during delivery, requiring specific maneuvers to resolve safely. Let us now look at question 39, focusing on medication safety in cognitive disorders. The scenario is, the nurse is monitoring a client who is prescribed donepezil. During ongoing treatment, which vital sign should the nurse focus on? The options are A. Heart rate. B. Fasting blood sugar. C. Cholesterol level. D. Oxygen saturation. The correct answer is A. Heart rate. Donepezil can cause bradycardia, so pulse monitoring is important to detect potential complications like syncope. Now, let us move on to question 40, which focuses on priority assessment in respiratory care for older adults. The scenario is, the nurse is assessing an older adult with pneumonia. What is the nurse's top priority? The options are A. Check that the airway is open. B. Perform percussion of the lungs. C. Listen to breath sounds. D. Measure the respiratory rate. The correct answer is A. Check that the airway is open. Maintaining airway patency is vital in preventing hypoxia and aspiration, particularly in older adults who may have compromised airway protective mechanisms. Percussion, auscultation, and respiratory rate assessments are important, but follow after ensuring the airway is clear. If you are serious about passing the NCLEX, this is the course for you. Our complete NCLEX prep course gives you everything you need to succeed. You will get live, interactive classes where you can ask questions and get real-time guidance. Alongside that, you will have access to 100 hours of animated crash course content designed to make even the toughest topics easy to understand. You will benefit from 500 hours of recorded lectures you can watch at your own pace, and 500 next-generation NCLEX questions, thoroughly discussed in detailed lectures. Practice with 5,000 previously asked NCLEX questions, and challenge yourself with 15 CAT-style mock tests to truly assess your readiness. You will also receive our exclusive NCLEX ebook, study planners for 1 week, 1 month, and 3 months, and comprehensive PDF notes. Best of all, you will have a full year of access to all these resources after you enroll. Do not wait. Take control of your NCLEX success today by enrolling. Let us continue to question 41, which centers on pediatric infectious disease. The scenario is, the parents of a toddler report that their child has difficulty sleeping, frequent scratching, and intense itching around the anus. Based on this information, what condition is most likely? The options are A. Anal fissure, B. Pinworm infection, enterobiasis, C. Jaundice, D. Celiac disease. The correct answer is B. Pinworm infection. Pinworms are common in young children and cause characteristic nocturnal perianal itching as the worms lay eggs. Anal fissures cause pain during defecation rather than itching at night. Jaundice presents with diarrhea, and celiac disease causes malabsorption, not anal itching. Next, we move to question 42, focusing on reproductive health education. The scenario is, a client visits the clinic asking about options for emergency contraception. Which medication does the nurse expect the healthcare provider to recommend? The options are A. Levonorgestrel, B. Tamoxifen, C. Finasteride, D. Methotrexate. The correct answer is A. Levonorgestrel. This progestin is widely available and effective in preventing pregnancy if taken within 72 hours of unprotected intercourse. Tamoxifen is for breast cancer, finasteride is for benign prostatic hyperplasia, and methotrexate is used for medical abortion or autoimmune diseases, not emergency contraception. Moving ahead to question 43, we address emergency blood product administration. The scenario is, the nurse in the emergency department is caring for a client with severe intra-abdominal bleeding. The client is hypotensive, tachycardic, and has a weak pulse. What blood product does the nurse expect to be ordered? The options are A. Packed red blood cells, B. Platelets, C. Granulocytes, D. Fresh frozen plasma. The correct answer is A. Packed red blood cells. PRBCs are used to restore blood volume and oxygen carrying capacity in the setting of acute blood loss. Platelets address thrombocytopenia, granulocytes are for neutropenia, and fresh frozen plasma is primarily used for clotting deficiencies. Let us now proceed to question 44, which focuses on medication calculation. The scenario is, a client is receiving an infusion of heparin at 1,300 units per hour. The bag is labeled 25,000 units in 500 milliliters of dextrose, 5% in water. How many milliliters will the client receive over an 8-hour period? The correct answer is 208 milliliters. This is calculated by determining that 1,300 units per hour equals 26 milliliters per hour, and multiplying by 8 hours results in 208 milliliters. Accurate heparin dosing is crucial, and the nurse must monitor for bleeding and be aware that protamine sulfate is the reversal agent if toxicity occurs. Continuing on to question 45, we focus on side effects of cognitive medications. The scenario is, The nurse has just administered the first dose of rivastigmine to a client with Alzheimer's disease. Which clinical parameter should the nurse monitor closely during ongoing treatment? The options are A. Blood glucose levels, B. Body weight, C. Kidney function, D. Hemoglobin and hematocrit. The correct answer is B. Body weight. Rivastigmine is associated with weight loss, so regular monitoring helps identify concerning trends early. Next, we proceed to question 46, which focuses on recognizing early pregnancy signs. The scenario is, during an initial prenatal assessment, the nurse notes Chadwick's sign in the client. How is Chadwick's sign best described? The options are A. A bluish-purple discoloration of the cervix, B. Softening of the uterus felt through the abdomen, C. Thinning and shortening of the cervix before birth, D. Absence of menstruation at the expected time. The correct answer is A. A bluish-purple discoloration of the cervix. This is due to increased vascularity in early pregnancy. Moving to question 47, we focus on environmental fall prevention. The scenario is, the nurse is evaluating the home environment of an older adult for fall risks. Which environmental factors should the nurse focus on? The options are A. Impaired cognition, B. Poor vision, C. Hearing loss, D. Inadequate lighting. The correct answer is D. Inadequate lighting. Poor lighting increases fall risk because it makes obstacles harder to see, unlike the other options, which are personal risk factors rather than environmental hazards. Finally, let us address question 48, which focuses on COPD prevention education. The scenario is, the nurse is leading a health promotion session on preventing chronic obstructive pulmonary disease. What should the nurse highlight as the most significant risk factor for developing COPD? The options are A. Environmental air pollution, B. Repeated bronchial infections, C. Cigarette smoking, D. Asthma. The correct answer is C. Cigarette smoking. Smoking is the leading cause of COPD due to its direct damage to lung tissue and airways. Let us now move to question 49, which focuses on appropriate delegation and supervision. The scenario is, the nurse manager is reviewing tasks that have been assigned to unlicensed assistive personnel. Which task would require the nurse manager to follow up? The options are A. Providing perineal care for a client with a urinary catheter, B. Assisting a client with passive range of motion exercises, C. Reminding a client how to care for a colostomy, D. Helping a client ambulate using a gait belt. The correct answer is C. Reminding a client how to care for a colostomy. Teaching or reinforcing education should be done by licensed nurses, not unlicensed assistive personnel. The other tasks fall within the scope of a UAP's practice. Next, let us transition to question 50, which highlights pharmacologic management of rheumatic fever. The scenario is, a client diagnosed with rheumatic fever is experiencing painful swelling in multiple joints. The nurse expects the provider to prescribe which medication? The options are A. Prazosin, B. Naproxen, C. Verapamil, D. Furosemide. The correct answer is B. Naproxen. Non-steroidal anti-inflammatory drugs like naproxen help relieve the joint inflammation associated with rheumatic fever. The other medications do not address polyarthritis. When it comes to preparing for the NCLEX, you deserve a course that offers true value at every step. Our complete NCLEX prep program gives you access to live classes where you can interact with top instructors, 100 hours of high-quality animated crash course videos, and 500 hours of detailed recorded lectures you can revisit anytime. You will gain confidence practicing with 500 Nigerian Naira questions, explained thoroughly, 5,000 real NCLEX past questions, and 15 CAT-style mock tests that feel just like the real exam. We include an exclusive NCLEX ebook, downloadable PDF notes, and customized study planners for 1 week, 1 month, or 3 months, so you can study at your own pace. And with 1 year of access after enrolling, you will have plenty of time to master the material. Start today. Enroll now, link is in description. Let us proceed to question 51, focusing on newborn thermoregulation. The scenario is, the nurse is caring for a newborn who is experiencing cold stress. What should the nurse also monitor for in this infant? The options are A. High blood sugar levels, B. Increased muscle tone, C. Low blood sugar levels, D. Metabolic alkalosis. The correct answer is C. Low blood sugar levels. Cold stress increases metabolic demands, depleting glucose stores and leading to hypoglycemia. Hyperglycemia, increased tone, and alkalosis are not typical results of cold stress. Continuing with question 52, we focus on infection prevention measures for varicella. The scenario is, a child admitted with varicella is under the care of the nurse. Which action is most appropriate for infection prevention? The options are A. Keep a dedicated blood pressure cuff in the client's room. B. Remove all personal protective equipment after leaving the room. C. Clean high-touch surfaces using warm, soapy water. D. Wear a gown when transporting the child to other departments. The correct answer is A. Keep a dedicated blood pressure cuff in the client's room. This helps prevent cross-contamination. PPE should be removed before leaving the room. Soapy water is not sufficient for disinfection, and the child should wear a surgical mask if transport is needed. Let us now move to question 53, focusing on heparin dosage calculation. The scenario is, a client receiving intravenous heparin is prescribed 15 units per kilogram per hour. The client weighs 70 kilograms. The available solution is 25,000 units in 250 milliliters of dextrose, 5% in water. The correct answer is 11 milliliters per hour. This is calculated by determining the total dose of 1,050 units per hour, which equals approximately 10.5 milliliters per hour, rounded to 11 milliliters. Moving ahead to question 54, we focus on treatment for peritonitis. The scenario is, a client has been newly diagnosed with peritonitis. What medication does the nurse expect the provider to prescribe? The options are A. Pantoprazole, B. Ciprofloxacin, C. Lactulose, D. Loperamide. The correct answer is B. Ciprofloxacin. This antibiotic targets common organisms responsible for peritonitis, while the other medications do not address infection. Let us now proceed to question 55, which focuses on prioritization in acute care settings. The scenario is, the nurse is prioritizing assessments for assigned clients. Which client should the nurse see first? The options are A. A client with a right femur fracture, who reports pain rated 4 out of 10. B. A client with chronic obstructive pulmonary disease reporting shortness of breath while walking in the hallway. C. A client with a T6 spinal cord injury from 6 months ago who now has a severe headache and is diaphoretic. D. A client 1 day post-open cholecystectomy with green drainage from a T-tube. The correct answer is C. A client with a T6 spinal cord injury from 6 months ago who now has a severe headache and is diaphoretic. These symptoms point to autonomic dysreflexia, a life-threatening emergency that can lead to dangerously high blood pressure, stroke, seizures, or cardiac arrest if not treated immediately. The other client situations, while important, do not pose an immediate, life-threatening risk. Next, let us transition to question 56, which focuses on pharmacologic management of narcolepsy. The scenario is, the nurse is planning care for a client diagnosed with narcolepsy. Which medication would the nurse expect the healthcare provider to prescribe? The options are A. Trazodone, B. Modafinil, C. Diazepam, D. Fluoxetine. The correct answer is B. Modafinil. This central nervous system stimulant helps promote daytime wakefulness, which is the primary goal in managing narcolepsy. Trazodone and diazepam are sedatives that would worsen daytime sleepiness, and fluoxetine is an antidepressant that is not indicated for treating narcolepsy. Let us continue to question 57, focusing on suicide risk assessment. The scenario is, the nurse is assessing a client for suicide risk. Which factor would cause the nurse the greatest concern? The options are A. The client has a history of alcohol dependence. B. The client has been on an antidepressant for 5 years. C. The client was recently diagnosed with psoriasis. D. The client recently joined a support group for psoriasis. The correct answer is A. The client has a history of alcohol dependence. Alcohol dependence significantly increases suicide risk due to impaired judgment, impulsivity, and emotional distress. Long-term antidepressant use, a psoriasis diagnosis, or support group involvement are not as strongly associated with heightened suicide risk. Next, let us transition to question 58, which highlights client education on diuretic therapy. The scenario is, the nurse is providing discharge teaching to a client with hypertension who is prescribed furosemide. What instruction should the nurse include? The options are A. Limit foods like bananas, cantaloupe, and potatoes. B. Do not take this medication with grapefruit juice. C. Take this medication early in the day. D. A nagging cough is a common side effect. The correct answer is C. Take this medication early in the day. This helps prevent nocturia and sleep disruption due to increased urination. Clients should actually increase potassium-rich foods. Grapefruit juice does not interact with furosemide, and a nagging cough is a side effect of ACE inhibitors, not furosemide. Finally, let us move to question 59, focusing on appropriate delegation to unlicensed assistive personnel. The scenario is, the nurse is working with a UAP while caring for assigned clients. Which task is appropriate for the nurse to delegate to the UAP? The options are A. Check the tympanic temperature of a client who received naproxen an hour ago. B. Empty and record output from a surgical drain after a mastectomy. C. Help a client select low-sodium foods from their lunch menu. D. Transport a client on a dopamine infusion to the intensive care unit. The correct answer is A. Check the tympanic temperature of a client who received naproxen an hour ago. UAPs can obtain routine vital signs, while interpreting the results remains the nurse's responsibility. The other tasks involve clinical judgment or monitoring that should be done by a licensed nurse. Let us now proceed to question 60, which focuses on newborn safety and emergency response. The scenario is, while checking on a mother and newborn, the client tells the nurse that someone who appeared to be a nurse took the baby to the nursery. What should be the nurse's initial action? The options are A. Contact the nursery to confirm whether the baby was brought there. B. Alert security immediately. And initiate a code pink for infant abduction. C. Ask the mother to describe the person who took the baby. D. Inquire if the mother asked for the daily code word. The correct answer is A. Contact the nursery to confirm whether the baby was brought there. The nurse's first priority is to verify the infant's location before triggering an emergency response, preventing unnecessary panic and disruption. Alerting security or gathering additional details would be appropriate only if the baby's whereabouts remain unconfirmed. Stop wasting time on scattered resources. Get everything you need in one complete NCLEX package. Our course offers live classes, 100 hours of animated crash review, 500 hours of recorded lectures, and 500 Nigerian Naira questions broken down with clear explanations. You will tackle 5,000 past NCLEX questions, 15 CAT-style mock tests, and get exclusive tools like our NCLEX ebook, PDF notes, and flexible study planners for 1 week, 1 month, or 3 months. Best of all, you get 1 full year of access to every resource after you enroll. Your NCLEX success starts here. Next, let us transition to question 61, which highlights monitoring of medication effectiveness. The scenario is, a client prescribed propylthuracil is being monitored for response to treatment. What lab test will the nurse expect the provider to order to evaluate effectiveness? The options are A. Serum calcium level. B. Thyroid panel. C. Fasting blood glucose. D. White blood cell count. The correct answer is B. Thyroid panel. The goal of propylthuracil is to lower thyroid hormone levels in hyperthyroidism, and a thyroid panel provides the necessary data to assess therapeutic response. While the WBC count helps monitor for side effects like agranulocytosis, it does not measure effectiveness. Moving on to question 62, we focus on pediatric medication dosage calculation. The scenario is, the provider prescribes ondansetron 0.15 milligrams per kilogram intravenously for a pediatric client who weighs 18.18 kilograms. The label reads 2 milligrams per milliliter. How many milliliters will the nurse administer? The correct answer is 1.4 milliliters. This is calculated by multiplying 0.15 milligrams by 18.18 kilograms to get 2.72 milligrams. Dividing 2.72 milligrams by 2 milligrams per milliliter gives 1.36 milliliters, which rounds to 1.4 milliliters for administration. Let us now proceed to question 63, which focuses on HIV testing options and client privacy. The scenario is, a client requests HIV testing and wants to ensure the results remain completely anonymous. What type of test should the nurse recommend? The options are A. HIV self-test at home. B. Rapid test at the provider's office. C. Inpatient antibody test. D. Community health fair rapid test. The correct answer is A. HIV self-test at home. This option allows full anonymity, as the client controls the process and results are not reported unless they choose to seek care. The other options are confidential, but linked to medical records or reportable to public health agencies. Continuing on to question 64, we focus on care for myxedema coma. The scenario is, the nurse preceptor is observing a newly hired nurse caring for a client with myxedema coma. Which action by the new nurse would require follow-up? The options are A, applying a cooling blanket to the client, B, requesting a prescription for hydrocortisone, C, removing the water pitcher from the bedside, D, keeping an oral endotracheal tube at the bedside. The correct answer is A, applying a cooling blanket to the client. Clients with myxedema coma are hypothermic and require passive rewarming. Active cooling measures like a cooling blanket are harmful and inappropriate in this situation. The other actions support safe and appropriate care. Let us now continue with question 65, which focuses on recognizing the effects of neurotoxins. The scenario is, a client presents with muscle weakness, double vision, and difficulty swallowing. The nurse suspects botulism. What describes how botulism toxin affects the body? The options are A, it is caused by infection with Clostridium difficile. B, it spreads mainly through contaminated water. C, it increases muscle contractions and reflexes. D, it blocks the release of acetylcholine at neuromuscular junctions. The correct answer is D, it blocks the release of acetylcholine at neuromuscular junctions. This leads to flaccid paralysis and muscle weakness, the hallmark of botulism. Clostridium difficile causes colitis, not botulism. Contaminated water is not the primary source. Contaminated food is, and botulism decreases, rather than increases, muscle activity. Moving on to question 66, we address post-procedure care. The scenario is, after a liver biopsy, how should the nurse position the client to reduce the risk of bleeding? The options are A, on the left side with a pillow under the ribs, B, supine with a pillow under the knees, C, prone with a pillow under the hips, D, on the right side with a pillow under the biopsy site. The correct answer is D, on the right side with a pillow under the biopsy site. This position applies pressure to the biopsy site, helping to minimize bleeding. The other positions do not provide the targeted pressure needed to protect the biopsy site. Let us proceed to question 67, which focuses on advanced care planning. The scenario is, a client asks about advanced directives. What is the primary function of a durable power of attorney for healthcare? The options are A, describes personal preferences for future medical care. B, authorizes someone to make medical decisions if the client is unable. C, assigns decision-making to a legal authority but prioritizes family input. D, specifies care to be given or withheld in any medical facility. The correct answer is B, authorizes someone to make medical decisions if the client is unable. This document allows the client to designate a trusted individual to speak on their behalf if they lose decision-making capacity. A living will describes personal care preferences. A POLST specifies treatments in various settings, and the appointed person's decisions override family opinions. Continuing with question 68, we highlight a key issue in information security. The scenario is, in a healthcare facility, what is the most common threat to technological and information security? The options are A, hacking by a foreign government, B, hacking by a domestic individual seeking ransom, C, staff failing to log off computers or sharing passwords, D, a major electrical system failure. The correct answer is C, staff failing to log off computers or sharing passwords. Human error, especially improper handling of access credentials, is the most frequent and preventable cause of data breaches. External cyber attacks, while concerning, are far less common than internal security lapses, and electrical failures are rare contributors to data breaches. Let us move on to question 69, which focuses on client education regarding urinary analgesics. The scenario is, the nurse is teaching a client who is being discharged on phenazopyridine. What information should the nurse include? The options are A, you may notice a larger volume of urine than usual. B, your urine may turn orange or red in color. C, your urine will likely develop a strong odor. D, concentrated urine is a normal effect of this medication. The correct answer is B, your urine may turn orange or red in color. Phenazopyridine is known for causing harmless discoloration of urine, which may range from orange to red. This effect should be explained to the client to prevent unnecessary alarm. The medication does not increase urine output, cause a strong odor, or directly result in concentrated urine. Next, let us proceed to question 70, highlighting adverse effects of anti-diabetic therapy. The scenario is, The nurse is caring for a client-prescribed sitagliptin. Which finding should the nurse recognize as a serious adverse effect needing urgent follow-up? The options are A. Mild nasal congestion, B. Persistent upper abdominal pain, C. Occasional headache, D. Mild dry cough. The correct answer is B. Persistent upper abdominal pain. Sitagliptin can cause acute pancreatitis, which presents as constant, severe upper abdominal pain and may be accompanied by nausea and vomiting. This requires immediate medical attention to prevent serious complications. Your NCLEX journey does not have to feel overwhelming. With our complete NCLEX success course, you will have the tools and support you need to feel prepared and confident. Join live classes where experienced educators break down key topics in ways that are easy to understand. Dive into 100 hours of animated crash content, 500 hours of recorded lectures, and 500 next-gen questions discussed in detail. Practice with 5,000 real NCLEX questions and 15 mock exams that challenge your critical thinking. You will also get an NCLEX ebook, practical study planners for 1 week, 1 month, or 3 months, and PDF notes to reinforce your learning. Plus, enjoy 1 full year of access to all of this after you enroll. Do not wait. Moving forward to question 71, we focus on group therapy development. The scenario is, while planning substance use disorder, group therapy sessions, the nurse organizes weekly topics and schedules the venue. This activity reflects which stage of therapeutic group development? The options are A. Working stage, B. Orientation stage, C. Termination stage, D. Planning stage. The correct answer is D. Planning stage. The planning stage involves setting up the structure, goals, and logistics of the group before it begins. The working, orientation, and termination stages occur once the group is operational. Let us continue with question 72, focusing on safe medication use in hyperthyroidism. The scenario is, a nurse provides discharge instructions to a client prescribed propylthiouracil. Which client statement best demonstrates proper understanding of this medication? The options are A. I need to eat more iodine-rich foods to help my thyroid. B. This drug might turn my urine reddish-orange. C. My healthcare provider will check my liver function while I take this medication. D. Once it works, I should start losing weight. The correct answer is C. My healthcare provider will check my liver function while I take this medication. Propylthiouracil carries a risk of liver injury, so regular monitoring is essential. The other statements reflect misunderstandings about PTU's effects. Finally, let us address question 73, which highlights adverse effects of aspirin therapy. The scenario is, a nurse is monitoring a client-prescribed aspirin. Which finding is most concerning and suggests an adverse effect that requires intervention? The options are A. Frequent urination, B. Low potassium level, C. Development of blood clots, D. Black or tarry stools. The correct answer is D. Black or tarry stools. Aspirin can cause gastrointestinal mucosal damage, increasing the risk of ulcers and bleeding. Black or tarry stools, melena, suggest upper GI bleeding and warrant immediate medical evaluation. This suggests gastrointestinal bleeding, a serious complication of aspirin therapy that needs urgent medical evaluation. Now, let us conclude with question 74, which focuses on emergency care for arrhythmias in infants. The scenario is, a nurse assesses an infant's electrocardiogram and notes supraventricular tachycardia. What is the most appropriate initial action? The options are A. Tell the infant to bear down, Valsalva. B. Apply an ice and water bag to the infant's face. C. Measure the infant's temperature. D. Check for a carotid pulse. The correct answer is B. Apply an ice and water bag to the infant's face. This method provides vagal stimulation, which is the first-line non-pharmacologic approach to slow the heart rate in supraventricular tachycardia. The cold stimulus helps activate the vagus nerve, potentially restoring a normal rhythm. Infants are unable to perform a Valsalva maneuver. Temperature assessment is not immediately relevant in this emergency, and brachial, not carotid, pulses are preferred when assessing infants. It is also important to have emergency equipment ready, as pharmacologic intervention with adenosine may be necessary if vagal maneuvers fail. Now let us complete our today's session with alcohol withdrawal and its warning signs in question 76. The scenario is, the nurse is assessing a client who was admitted 12 hours ago for alcohol detoxification. Which of the following findings should the nurse recognize as a symptom of alcohol withdrawal that requires prompt intervention? The options are A. Fine hand tremors and irritability, B. Slow heart rate and constricted pupils, C. Elevated temperature and auditory hallucinations, D. Pinpoint pupils and shallow breathing. The correct answer is C. Elevated temperature and auditory hallucinations. These findings signal the possibility of alcohol withdrawal delirium, or delirium tremens, which is a medical emergency. If not addressed quickly, this condition can lead to seizures, cardiac instability, and death, fine hand tremors, and irritability. The key clinical insight here is that alcohol withdrawal can escalate rapidly. Red flags like fever, hypertension, tachycardia, confusion, hallucinations, or agitation require immediate intervention with benzodiazepines and supportive care to stabilize the client.